and will be available for attendees following the conference. The Q&A period will not be recorded. Live captioning is available at the bottom of your screen. You can enable this by selecting the live captioning feature. Please note, these captions are not 100% accurate, so if you notice any errors, that's why. So it is possible that we might experience some technical issues during the presentation. We ask that you please be patient should a technical issue arise. If a problem, such as the speaker or the speaker's video or audio is freezing, if anything like that should occur, we will wait a few minutes to see if the issue can be resolved, and we'll communicate with attendees any alternate plans. I'd like to take this time to thank our sponsors of Babar, Paragraph, Archambault, and Renaud Bray for their generosity in making this conference happen. I am now pleased to welcome John Dupuis. John is a scholarly publishing librarian and science and engineering liaison librarian at York University in Toronto. John received his bachelor's degree in computer science from Concordia University in 1986, after which he worked as a software developer for 12 years before leaving to get his Master's of Library and Information Studies degree from McGill University in 2000. He blogs sporadically at Confessions of a Science Librarian and tweets at DupuisJ, and that's his Twitter handle. Without any further ado, I will ask you all to help me welcome John. So the floor is yours, John.
Well, thank you, Veronica. So what am I going to talk about today? I'm going to talk about basically my experiences over the course of the last couple of years. And first of all, I would like to thank Barbara, an old friend from my CEGEP days at Marianopolis, for inviting me to propose a session, helping me to kind of I guess, concretize some of my experiences during the last 2 years and frame them in a way that hopefully will be useful and generative for other people. And so what's and I also say I really wish that we could all be together and heading out to some fine restaurant afterwards this evening to hang out and share drinks and a nice meal. But I also need to acknowledge that, you know what, somehow that hasn't worked out so well for in-person conferences recently. Katie Mack, a well-known science tweeter and blogger and writer, conference hashtag during conference, talks, updates, photos, conference hashtag after conference, rapid test pics, symptom updates, contact tracing. And we can see also here that I find this interesting from the last couple of days as well. The Medical Libraries Association had an in-person conference recently, and it's the same experience. Attendees catching COVID at the conference and commiserating about that. So just a warning: this is far from a cheerful presentation. Because it's a far from cheerful time, and hopefully we will be able to help each other get through a little bit of mutual support. So we're all librarians or library people, library staff members involved with the library community, and I think if there's one thing we all share, it's this rather perhaps naive notion that information is important. That somehow, if we have information, we will make good decisions. Somehow that we have information and we're going to act on that information. Whether it's whether it's leisure activity information or scientific information that's going to help us with public health policy. I think we have this naive belief that information is going to help us, and that we will act on that information, that our governments will act on that information, our corporations will act on that information, that it's just a good thing, right? But but faced with life today, we can think to ourselves, how much is that information actually been used? Do we have good information, and has it been used, right? And so again, what's this current COVID strategy feels like? It feels like we're all being gaslit, right? That somehow there's two realities going on right now. There's a reality that's kind of there's the reality that's really happening, and then there's the reality nobody wants to talk about, right? And so this, I think, is something that perhaps we've all been thinking, and perhaps maybe we've all been trying to suppress in our subconscious, right? And it's, of course, it is too simplistic to say that better information would magically make everything better, right? I'm not quite that naive. The decision-making process in organizations and in governments is very complex, and it's not just around having the best information. There's a lot of other political, ideological, practical, social reasoning around making good decisions and applying evidence to the decision-making process. So I'm not, like I said, I'm not naive enough to say that if we could make everybody read Nature, that suddenly all the world's problems would go away. But right, what are some of the places where, yes, it would be really nice if we perhaps would use our information a little bit better? Right, so one of the common things we see about COVID is, it's just the flu. Well, 15 million people have died, and that's far more severe than the flu. And we see the impacts of long COVID, right? Recent studies, severe cases of COVID are roughly equivalent to 20 years of aging in terms of our cognitive state. Again, we think to ourselves, well, if I catch COVID, I'm done. I won't catch it again. That's fine. But what we're seeing is that that's not the case, right? Immunity from vaccinations or infection wanes very quickly. And, certainly we see reports of people getting COVID 3 and 4 times over the course of the last 2 years. And we probably all know people that have gotten COVID at least twice, right? I know several people that have gotten COVID twice. I'm not sure if I know anyone that's gotten it 3 times, but I know several people that have gotten COVID twice. And so it's not one and done. Right. The other thing we think to ourselves, right, it's like getting a cold, right? You might get really sick. It's like getting the flu. You might get really sick, but once it's done, right? There's no long, we've all had the flu, and it might be kind of tough for a week, maybe even 2 weeks. But then when we're better, we're better. But that's not as we're seeing more and more, that's not the case with COVID, right? The long COVID can have impacts, can have long-term impacts on our health. And we're still really only starting to understand that. And there was a recent study that said that, we could be facing up to 1 billion people on the planet with long COVID. Now, long COVID isn't the same for everybody. What percentage of people are truly disabled by their long COVID? I don't think we know what the numbers are on that, but it's not zero. And that one study that only 29% of UK hospital patients, UK COVID hospital patients, recover within a year, right? There's people that got very sick, and even within a year, they're not completely better. And that's kind of not, and that's hardly an ideal situation, right? And it's mild. That's another thing that we're hearing. And it's mild if you're fully vaccinated and you have good immunity. But as we're seeing in, for example, Hong Kong, if you have a poorly vaccinated population, it can be very serious. People get very ill, and a lot of people die. And so again, what we're seeing is, though, in some ways Omicron might seem mild, but it isn't. So another kind of myth. Right, and another one, one of the things that I find really interesting about the experience over the course of the last 2 years is in a lot of ways we're kind of stuck on the things we learned in the first couple of months of the pandemic. Wash your hands, keep your distance, let's set up the plexiglass barriers. But it became apparent very, very quickly that that COVID is an airborne disease like the measles. And it's not so much, oh, I'm breathing on a person. COVID behave, the COVID aerosols that spread the disease behave much more like cigarette smoke. And so if you're in a space and you think to yourself, well, okay, what if there's somebody in here that has COVID? Well, it's not so much, are they standing right next to me and breathing on me? It's like, well, if they were chain smoking, how smoky would it be in this room? Right? That's more the way we have to see these things. And so again, so this obsession with hand washing, normal hand hygiene is great and should be encouraged. But the mania about sanitizing your hands is unfortunately not that useful. Right? Again, kids don't get it. That's not true. Lots of kids get it, and in particular in the more recent outbreaks. And we've seen there's been a lot of spread in schools. This is something that was like kind of disputed very early and unclear. But I think it's pretty clear that the quietest times that we've had over the course of the last 2 years with COVID have been when schools have been out. So, and again from the anecdotal information, I don't know about you, but for me, most of the people that I know that have gotten COVID over the course of, say, the last 6 or 8 months have young children in school, right? That's so there's a lot of evidence that yes, schools are sources of infection. Right? It's endemic. That's kind of that. First of all, endemic isn't necessarily a good thing. Malaria is endemic, and lots of people die every year from malaria. So COVID's not endemic. It hasn't settled into this really predictable spread, and that sort of thing. There's still outbreaks. It's still unpredictable, and even if it were endemic, that doesn't necessarily mean that's a good thing. And again, it's over. We're in a weird time right now. We seem to be on the downslope of the winter waves, which as we were at this time last year and 2 years ago. So it's easy to think, yeah, it's over, but we don't really know. And the last 2 times we thought it was over going into the summer, we were wrong. So we should beware of claiming victory too early. And as these numbers show, in fact, the last 4 to 6 months have been in many ways amongst the worst months of the entire pandemic. In a way that hasn't, since our governments aren't being so wonderful with sharing data and collecting data, it's not always as obvious as it was before. And there's many more pandemic myths. And the two big ones that I didn't even discuss, masks don't work, and the whole thing around vaccines. The mythologies around those are almost worth their own presentations. But I think in many ways the biggest myth that has become so apparent over the course of the last 4 to 6 months is that we're all in this together. We are so very clearly not all in this together. So those of us that have been very fortunate to be able to work from home, or that don't have young children in school, have had a much easier time of it these last 2 years. Those of us that have been able to afford, that have cottages, that have been able to afford to kind of get their groceries delivered, to not work in high-risk places. There's a lot of privilege there, and I think we need to remember that we aren't, so much. One thing that is so true over the last 2 years is that we're not all in this together. And so for example, just some of the things here, the immunocompromised. Again, it seems like many of us are enjoying a little bit more freedom in our lives these last few months, whereas people that are immunocompromised, in many ways, have a much harder time. The toll on essential workers, working women, the racial inequities on COVID spread, it's been quite serious. So, so my presentation isn't about COVID. you know, as I say here, I'm not an epidemiologist or a sociologist or a psychologist or an engineer, right? What I am is a science and engineering librarian. And so, you know, how does my expertise, you know, seeing from that, all that's come before, how does my expertise kind of intersect with all of those kind of information deficits, right? And seeing all of this, how could you not want to do something? And certainly that's how I felt, you know, going into this. And so how did I get into all of this science policy stuff? It's actually quite a long story. It really started really way back in 2009 during the Harper conservative government. And certainly there was, I don't know if you would actually call it a war on science. It was convenient to call it a war on science, get it made for nice article and blog post titles. But certainly there were not good years for science. And you know, one of the first things that I noticed was how it was affecting the kind of the science library infrastructure in Canada. And you know, those of us that have been around long enough to remember SISTI, so that Canada's Science Library, was kind of reorganized and shut down and, you know, redeployed in that era. And it seemed to be in kind of a careless and rush way, a hallmark that we're going to see over and over in all of these things. And so that kind of, so at that point on my blog, I started documenting a lot of the things that were happening on the science front at the Canadian federal level under the conservative government of that era. Kind of culminating in 2013, when just, you know, enraged at the anti-science nature of the government in so many ways, I created this blog post that basically cataloged all the things that were happening at that time that were anti-science. And that's the one you see at the top there. And so there was probably about 100 or so things that I found, and I generated about another 100 comments in the post with other people saying, oh, because I did that post, I didn't try and be, I didn't try and be comprehensive or complete, because I knew that would just kind of take too long, and I just wanted to get something out there. And so that kind of started that, right? And it ended up being kind of a really interesting experience. And I went on and documented some other things. Probably, and the other thing that I documented most completely at that point was what was happening at the Fisheries and Oceans libraries. So a whole bunch of them were shut down, again, in a careless and hurried way. And again, so there, I did a lot on my blog in that era about about the Harper government's anti-science activities. And here's just, kind of some of the highlights. I was, it was kind of an interesting time. I had an opportunity to do a fair number of media appearances and, and write some articles in mainstream media and do a bunch of public presentations. So that was kind of an interesting time. So, what would a presentation at a library conference be without a literature review? So obviously, we're very early days in the pandemic, so there hasn't actually been that much that's been written in the library literature. Certainly on the order of tens of articles that I was able to find in a quick literature review, as opposed to hundreds or anything like that. Here's some of the ones that I found that I thought were kind of interesting. Utilization of libguides to disseminate information, and results show libraries tend to start from scratch and share the same resources, duplicating efforts. I think we've all been guilty of that one. Here's another one for health science librarians, experiences, again, talking about creating information resource guides, using Zoom for workshops, email messages, and that sort of thing. Again, all the kinds of things, Camtasia, videos, tutorials, and that sort of thing. Again, stuff that seems like a good idea. This other one about creating data portals and that sort of thing, another thing that librarians have been able to do. And again, so this, the impact on information literacy instruction. Here an experience on decreasing one-shot instructional sessions. Again, I think something that we saw fairly widely. But the converse, I think, the experience here was that they were able to use the switch to online to be a bit more targeted and to actually kind of do new things and pitch new services and pitch new ideas. And so I thought that was kind of a really interesting thing as well. And there is this very interesting systematic review of a whole bunch of different articles around how libraries reacted to the pandemic. This one, fairly recent. They did find, I think they found 12 studies that they used in their systematic review. And so there's this one's actually really interesting to go through. And it's really nice because they kind of pick out the major themes that libraries are kind of working through and working around in the response. And so I thought that was really interesting in terms of challenges, emerging roles. Again, very interesting. So what did I do? And some of the things that I did were pretty sustainable and successful. And as I'm sure all the rest of us has discovered, some of the things that I tried, didn't end up being such a good idea after all. But of course, in such a time, we just try things for the sake of trying them sometimes. And so it's worth noting that from summer 2020 to summer 2021, I was on sabbatical. And so a lot of the experiences that people had in fall 2020, I didn't have. That kind of initial adjustment to teaching with Zoom, I didn't have in fall 2020. I got that in fall 2021 when I was back from sabbatical. And a lot of the rush around finding online equivalents for print textbooks and that sort of thing, again, I kind of missed a lot of that. I got some of it before I started my sabbatical in August, through I guess from March through to June, July. I did experience some of that. And I also did one class. My portfolio tends to not have a lot of classes in the winter and especially the spring and summer sessions. So I only did one class, and that was asynchronous. Anyways, a prof and I did kind of a Socratic discussion and debate about library resources and recorded that, and he made it available for his class. So what did I do? When I started, I'd already been tracking for the Trump administration, the kind of the bad science and anti-science activities of the Trump administration since, I guess, the fall of 2016, through the entire Trump administration. So as we ticked over into pandemic times, I kind of switched into tracking the Trump administration reaction and response to COVID-19. For many reasons that I'll get into, in a moment, I kind of swapped to Ontario and Canada in early 2021. One thing I started right at the beginning was, doing kind of extensive blog posts, trying to reframe the kinds of things we would do in LibGuides, but in a way that made sense for me to do in my blog, as opposed to a LibGuide. And again, so I did some work around Canadian universities and, of course, my instruction practice starting in fall 2021. And I did end up on the library's Health and Safety Committee somehow starting this year in January, and that's proving to be kind of an interesting experience as well. So documenting the Trump administration. Like I said, I started that really as far back as the fall of 2016. And that was kind of an interesting process. I did a few blog posts on that, and was kind of, again, trying to systematically keep track on a month by month, day by day basis of what was going on. Once the pandemic hit, I switched basically to totally focusing on that. And as you can see, I have some links here to blog posts I did on a few of those. And it was, but But ultimately, what happened is and again, I'm on sabbatical during this period as well. But what happened was it ended up being an almost unsustainable fire hose of information. And it ultimately I found, especially with, again, the stresses of the pandemic and that sort of thing, I found it difficult to to finish things. I was surprisingly productive, but I think what I ended up doing was gathering a lot of data and a lot of information, and not quite being able to do useful things with it. And so what seemed to make sense to me at that time was to switch out of Trump, and because I literally probably gathered thousands upon thousands of kind of the data points in tracking the Trump response. And it was like I said, it was just a fire hose. And you can see here, I have some links here related to stuff from pre-pandemic and post-pandemic. Oh, and by the way, as we saw from the beginning, as I go through some of these blog posts, my slides are available. And so if you want to follow any of these links, at the end, I'll remind you what the link is for these slides on Google Docs, and you can follow any of the links that are in my presentation. And so all of these are links, and you can follow them if you wish. And so this is what a post would look like. I picked this from one of the posts, and so kind of this is how I would document what was going on. And so in winter 2021, so a bit over a year ago now, it's as we were transitioning into the Biden administration, it seemed like a good time to transition my tracking, because again, just of the fire hose, I was, again, like I said, it was kind of hard to finish things. But so what I did was I transitioned to tracking in particular the Ontario government's pandemic response, and in a kind of more general way, the pan-Canadian response, the federal government and the other provinces, but mostly the Ontario government. And that actually was, I should have done that from the beginning, because it was much more focused, and I was able to every month I was able to gather a month's worth of information and publish that month's worth of information. And so we see here I have February and March. Sadly, unfortunately, I broke my arm mid-April 2021, so there was about a month that I wasn't really able to work on these sorts of things as I was recovering. So April and May 2021 are about 50 or 60% finished, and so I need to get, at some point I'm going to need to go back to finish those. But again, like I said, for the most part, I've been able to do 1 month's worth of work in 1 month and finish and prepare for publication on my blog that month's worth of work. For what it's worth, I was slowed down a little bit by the regular school year. So most of the stuff from the school year, April 2021 to September 2021 to April 22, all that is about 99% finished. I just need to sit down one day and publish them all on my blog. Like I said, they're 99% finished. I just need to get them out. And so this is what one of them looks like. This is 1 day of tracking from February 2021. So what we can see, and so this is what we can see here, and this is a link to the post. What we can see is picking up all the news, all the interesting news about Ontario from that day, and just a briefer segment of the news from Canada from the rest of that day. And so this is kind of how I went about it. And now I also transitioned. I'm getting some information again about kind of the rest of the world as well, in particular about vaccines and that sort of thing. But so this is what I would do. I'd do this every single day, just kind of get this ready, and by the end of the month have something that included that full month's worth of information, full month worth of documenting what was happening every day. And so I think more importantly, I ended up doing, in some ways, more importantly, I ended up doing what is effectively what I have ultimately started calling the COVID information series, which I like to think of as myth-busting posts. And so starting all the way back in the early days, these first two I did in the first 6 months of the pandemic. One of the things that was obvious very early, again, was that we're not all in this together. And in that first 6 months or so of the pandemic, women scientists were bearing a large part of the brunt of coping, and we're having a tough time. So I did a post that basically documented all the articles and research that had been published at that point about the experience of women during that first bit of the pandemic. The other thing that was really like my main job is scholarly publishing librarian, so all around scholarly communications, my other job. And so that was also something that was really obvious, that in particular the rise of preprints, that there was a huge, massive shift in how people were looking at scholarly communication and scholarly information in that very brief, because all of a sudden things had to move at light speed for researchers on COVID and COVID vaccines and other things. And so that was a really interesting thing for me as well. So I picked out, again, for that first 6 months or so, a lot of, and the shifts are still happening. It's just not as dramatic as it was, not as dramatically as apparent as it was right at the beginning there. So I documented that, and I did, again, a bunch of these other things. I did one post that had a rude title to start with, and so I created a new version of that had a less rude title. But again, hygiene theater, it was an issue. How can we use CO2 monitors to make things, to kind of get a sense of how safe our spaces might be? Again, masking and mask mandates, are they good? Are they not good? What's the research on that? Again, COVID's not over. I did that one fairly a month or two ago, that obviously everyone was, everyone was fed up, but not quite ready for we're done with COVID, but COVID's not done with us. And that's kind of, the point that I was trying to make in that COVID information series collection of resources. And of course, the one that, the most recent one that I published just very recently, within the last few days, is one on long COVID. In other words, bringing together a lot of information on, okay, what's some general information on long COVID? What's some information about kind of the different ways it manifests itself? Does it affect children? Again, just kind of a resource post, something, again, the kinds of things that you could do on a LibGuide. And so again, here's an example of what one of these posts might look like. This is the masking one. And so this one, each post I've done in kind of a slightly different format, depending on what made sense for that particular topic. But this is how I did the masking one. I had a bunch of different categories. Each category, I pulled out a few what looked like to me to be really key scholarly articles, or high quality government reports. A few of these here from the CDC on this, that are highlighted on this page, about what masks work. This one is about masking in schools. Masking in schools works. Schools that have mask mandates have less disease than schools that don't have mask mandates. And so that was something that was really, really important to me, to pull all those kinds, all that kind of information together. And another thing that I did was I did document the kind of the situation that was going on in Canadian universities. One thing that, as I was kind of getting ready to go back to the non-sabbatical life in summer 2021, that's when kind of the whole thing about vaccine mandates hit. And it really seemed like Canadian universities, and again, it's not quite the same across Canada. There's some weird little wrinkles between provinces on how university mask mandates were implemented. But it seemed like universities weren't interested. They're like, we're just going to open up. We're going to have a regular school year. Everyone's going to be on campus, whatever. And so there was a lot of pushback on that in social media, Twitter, blogs, and so one of the things that I did in that summer was like, this is kind of something, this is a phenomenon that's worth exploring. So I did do a couple of posts, kind of, both taking that kind of advocacy side, saying, I think vaccine mandates are a good idea. And again, kind of trying to list places that, this other post listed places that had mandates at that point, and just, some other kind of information. It's worth noting again that I do have, since I'm an academic librarian with the librarian equivalent of tenure, I can post these kinds of things without fear of, overly upsetting the administrators at my institution. And so again, then I did a series of posts just tracking basically the last school year in a couple of posts, from basically the fall, the winter, and then the last bit of the winter term about what schools were going to do about the mask mandates. And so one of the really interesting things, again, like I said, I missed the 2020-2021 school year. I was on sabbatical. And so I didn't do that Zoom teaching that everyone else did. So, it was a bit of a rude awakening for me when I started back to non-sabbatical life in last fall. And so it did take me a little while to kind of adjust to the Zoom teaching. And most of all my teaching is in engineering. All the information literacy that I do is in engineering and computer science for the most part. A few other things in other areas, but for the most part, it's all engineering and computer science. And most of the classes that I do for engineering are design courses, right? So in other words, the job of the students in this class is to come up with a design for something. And by the time they hit their 4th year capstone, their job is to design and build something. And so, I've always worked with the faculty in these courses, in these design courses, to say, there's a library role in these courses, and that's to help the students gather the information they need to justify the design decisions that they make in their projects. And so this is, and I'm a LibGuide person for these. I like to have LibGuides. I have a link again here to the LibGuide that I did for this particular class. I like to use the LibGuide to frame the resources. I'm not a slides person for IL sessions. So I kind of have a section of the LibGuide that frames how I want to talk about the session. And then I have sections in the LibGuide, one section with ebook sources. So again, for engineering, I'll have a section for the patent search engines. I'll have a section for the standard search engines and all that kind of thing, the stuff that makes sense for engineering. But for this Civil 2000, their first civil engineering design course, and I've been doing this more and more. What I want to do is what I wanted to do last year was I wanted to say, let me see if I can have a COVID angle on these design courses, right? Because the students are living through this. The faculty members are living through this. We're all living through this. Let's just face it. And the way I do in a design course is I say, let's workshop a design idea I've had together and work through all the different information needs of this design project, thus hopefully modeling for them how they would work on their project. And so for this one, I don't remember what the projects that they did, the students did. They did a whole bunch of different, kind of ideas here. And so the project that I was using was design a COVID wastewater monitoring system for a campus residence or other institutional building. And there are Canadian campuses that did have, I think Guelph and U of T, at least that I can think of, probably others, that did have wastewater monitoring, COVID wastewater monitoring on their residences. And so I said, let's workshop how we would design such a thing. And the first thing I did was to say, and again, this is again very typical in how I run these design sessions, these design courses. How am I going to, how do I justify my project as a good project to do? How do I justify this approach? In this case, how do I justify that wastewater monitoring in a residence is even remotely a good idea? So I picked up a couple of scholarly articles on that, including first one here by York people from my institution. And I find especially with a second year course, it's a good idea to say, it's a good way. This is a kind of a painless way to introduce them to scholarly, to kind of journal articles and that sort of thing. So I did that, and I did, again, I just had some other kinds of ideas on what resources am I going to use, how am I going to justify this, what kind of categories, in Zoom, I'll get to do this part, I'll get the Zoom whiteboard going, and let's see if we can come up with different categories and different kinds of data we need within each of those categories. And so, but I found this is kind of a really interesting way to run this, to make it about COVID. And that's kind of, and ultimately that's what I ended up doing for a lot of my classes, if it made sense. I mean, it didn't make sense in every context for every class. But, for example, a general engineering design course, I could use ventilation, right? Designing a ventilation system for a building, right? How would you do that? That's a typical mechanical engineering problem, but there's a COVID angle to that as well, right? And so that's something that I found that was really easy to do, and it seemed to be quite engaging for the students as well. And it was also kind of a lot of fun for me. And, in particular, coming back from sabbatical, it's nice to, renovate all of your instructional practice and do new things again. And again, so like I mentioned, I was on the health and safety committee. And so there was doing some COVID-oriented workplace inspections. That was really interesting, talking about plexiglass and, making sure people were masked, and if they're not masked, reporting it to the powers that be. I also, a couple of things that I'm not going to dwell on here since we're recorded, but I got my dean not so happy with me on a couple of occasions. I did request, at one point I did request if there was ventilation data about library buildings that was available, that we can make publicly available, and that didn't go well. As you can imagine, the universities have touted a lot of their ventilation improvements, but that hasn't, I think they like to talk about their ventilation improvements, but as soon as someone might say, well, let's see if we could actually prove that the ventilation is better than it, or let's see if we could prove that the ventilation is good. There seemed to was, let's say, more than a little bit of pushback on that one. The other thing we did, a colleague and I purchased a couple of CO2 monitors for the library. We ended up purchasing them through the regular collections budget. The idea was to make them available as, like, say, 3-day reserves. So students, staff, faculty could take them into their spaces, classrooms, their homes, or wherever, just to get a sense of what is the air clean in this space? Is this a safer rather than a less safe space? And let's just say that also did not go well once our dean noticed that we had in fact purchased this thing and we were planning to make it available to students. They were removed from the collection. And so, there's a lot of different things that we've tried. And I think, I think there's going to be some more opportunity, to do those things this summer, maybe than there was last summer. I'm still not giving up on making those. They're just sitting in somebody's drawer somewhere. I'm still not giving up on making those CO2 monitors available to our community. I've also been fairly active on Twitter. And there's a fairly active Twitter universe of COVID advocates. Most of the people that I see are kind of within academia, as you can imagine, but also just kind of in the general public and amongst the medical community. Yes, Kate Dupuis is my cousin. And so they're just kind of an interesting mix of people. Again, most of the people that a couple of my York colleagues, Dawn and James, and some people from Guelph, Shoshana and Ryan. Kind of an interesting world out there. So what else could academic librarians do? What else could academic libraries do? And this is kind of what I'm hoping, we have some time left. This is what I'm hoping that we could discuss. I've had some ideas. We've tried a few things, but it would be nice if we all had some ideas about what we could do together or in our institutions. And so my idea, I'll throw out an idea first. Like, again, the one that didn't work out so well. Why couldn't we lend CO2 monitors to our communities? They cost about 300. There's this Canadian company, Prescient X. And after I finish sharing, I'll put a link to the company in the chat. There's this company, there's this Canadian company that sells the Aranet 4 CO2 detectors for $325. And so we purchased 2, so $650 approximately. Now, it sounds like a lot, but I could sitting here at my desk, I could spend way more than $650 on technical engineering books in 10 minutes, and no one would blink an eye, right? York's collections budget is $15 million, right? And so, is there scope to do things that could help our communities understand the situation that they're in a little bit better? And we see here the Peterborough Public Library is lending CO2 monitors to their community, and that's kind of an interesting idea, and that we tried. It all went to hell in a handbasket in December and January of December 2021 and January 2022, when kind of everything hit the fan. Well, why couldn't we try? Like I said, I'm willing to try again, and why couldn't other places try? Maybe you would be luckier making your case to your administration, especially now that the temperature's down, the temperature's kind of decreased a little bit. There might be an opportunity to do that, and make those CO2 monitors available, so students can see how good is the ventilation in this classroom, how good is the ventilation in my apartment or my house, or the basement I share with 5 other people, or whatever. Students have a complicated and interesting lives, right? So being able to borrow a CO2 monitor for their schools, homes, workplaces, just to check them out and see if things needed to be improved, I think that's something that a substantial difference that we can make in real people's lives. And again, probably other ways as well. So what's next for me? A whole bunch of things. I'm going to try and finish up a bunch of the posts that are almost finished. I got, some more ideas for the COVID information series. In particular, I think the next one I want to do is the whole live with COVID thing, including like wastewater monitoring, why good data is important, some more kind of targeted information on ventilation and that sort of thing. I am more about, I'm coming, in a few months, I'll be up against a fall and winter of instruction again. My instruction is, I was a little bit down at my year after the sabbatical. Hopefully, I think I'm going to I'll probably be up to a more normal number of sessions this coming year. A normal number of sessions for me is maybe about 12 to 15 in the fall, and 5 or 8 in the winter. And so I'm looking forward for 22, 23 to being up around that number again. And again, just a bunch of different things. And so again, now, I think we have time for some questions. And in particular, here's a link to my slides. And I'm hoping that people, again, all the links to everything that I did are on those slides. So if people want to follow what I did, more than happy to, I'm more than happy for people to use my slides, again, with a Creative Commons license. So do whatever you want with them. And my contact information is there. So if you have any questions, if you think of any follow-up questions or concerns or collaborations in coming days, weeks, and months, don't be shy. So anyway, so I'll stop sharing. And like I said, I think we have some time for questions and discussion and all of that.
We do, absolutely. So I will stop recording now. Thank you so much, John, for such a great presentation. That was very enlightening.